We are in a crisis. The hospital systems will collapse.
In an open letter, more than 1,100 healthcare workers are imploring elected officials and state health leaders to do more to mitigate the spread of COVID-19. Some of those healthcare workers hosted a virtual press conference today to reiterate the demands set forth in that letter. KOLD News 13 Shaley Sanders joins us with more on why they say the current situation is unsustainable.
I think what we're asking for is a backup plan. We've burned through all of our backup plans.
Dr. Ruth Frankston-Edicor is one of the more than 1,100 doctors who signed this open letter, demanding more consistent mitigation measures to help ease the strain on our state's hospitals.
We've gotten really creative with the resources we had at our availability. We stretched the use of PPE. I know there's no more backup plans. This is it. We are at collapse.
The letter, in part, asks hospital systems to adjust and enforce consistent hospital visitation policies, require N95 masks for everyone working in patient care areas, and KN95 masking for visitors, provide access to rapid response COVID-19 testing within healthcare facilities for workers, and enact efforts to stabilize, recruit, train, and retain healthcare workforce to improve staffing.
Just this morning, I sat in the office of my own 80-person plus hospitalist group. And I sat in the office of the practice manager. And she looked me dead in the eye with her tears in her eyes welling up. And she says, my 2 admitting physicians for this weekend just informed me that they both have COVID. She goes, I don't have anyone to admit patients to the hospital.
These healthcare workers, including Dr. Christina Bergen, are also calling on elected officials to do more to protect communities.
Urgently increase testing capacity, availability, and accessibility to include widespread mass testing sites. Reintroduce the widespread mass vaccination pods, administering boosters and vaccines.
And as these healthcare workers strive for more mitigation measures, they say they are continuing to struggle with the emotional toll this pandemic is taking.
We see scores of patients die without time to process these traumatic events.
We have an opportunity to change course. Inaction by our hospital leaders and lawmakers at this moment during the pandemic will be viewed by the healthcare community as an informed decision to ignore the health and safety of the communities we serve, and an attack on those sacrificing their health and safety to care for their community.